When it comes to prostate cancer, IV therapy can be one of the most powerful therapies to support the body if it is done appropriately. I'm Dr. Jake Schmutz, a naturopathic medical doctor and integrative oncologist. IV therapies are not traditional therapies for cancer, but they are great tools alongside traditional therapeutics. IV therapy is doing substance or administering a substance via an IV, via your vein. So why do we want to do that instead of just a supplement that you take orally that goes throughout your gut? One big reason is we're able to get higher doses more quickly into the bloodstream. So when we do it intravenously, we're able to get a substance in there immediately within seconds. And it's going to go throughout the body very quickly. I mean, like a lot of times we do a substance and you can taste it within seconds, get throughout your gut and get absorbed into the bloodstream. So it's a much slower response of absorption. Also, everyone's absorption rates are different and how they absorb a certain supplement. So IV therapy is going to be much better there. But in cancer's case, you can't get the dose or the concentration that we need to have the anti-cancer effect through just oral means with many substances. With certain substances that do get absorbed well, oral supplementation can be great. But in other circumstances, intravenous therapy is going to be much better. Or the oral therapy can be pretty good and you get this little baby hit, and then we periodically get with a really strong concentrated dose when we do it intravenously. I use IV therapy in prostate cancer for similar to some of the things I already talked about. So for example, like high dose IV vitamin C, you're never going to get the right dose that you need through oral vitamin C. You can't do that. You're just going to get really bad diarrhea if you try to, and you're never going to get the dose that you need. So we're doing at least 25 to 75 grams to 100 grams of vitamin C. You can't take that orally, and your gut cells won't let you be able to do that orally. High dose vitamin C is one of my favorite therapies for prostate cancer and various other cancers, because what it does is it directly kills just cancer cells and supports the immune system and doesn't harm any of your normal cells. That's really cool about vitamin C. So how it works, cancer cells love sugar. That's what they use for its fuel source. Vitamin C, also known as a ascorbic acid molecule, looks a lot like sugar. So a cancer cell sees the vitamin C circulating. It's like, yes, I see some sugar. I'm going to gobble that up. It takes it in. So it's kind of like a Trojan horse type of thing happening. It takes it in. And then the vitamin C gets broken down into hydrogen peroxide. Cancer cell can't break down that hydrogen peroxide. The hydrogen peroxide then damages the cancer cell and kills it that way. Now, this only happens with high dose IV vitamin C through IV. We do not see this effect through oral supplementation. You're not going to get this effect. You're going to get this with 25 grams or more. And most of the time, you're going to usually have to go to 50 to 75 grams, which I have special techniques to know exactly how high a dose we need to go for in specific situations for each individual. And normal cells don't get damaged by the hydrogen peroxide. Normal cells take out the vitamin C. The vitamin C breaks down to hydrogen peroxide, but normal cells break it down into water. So that's the difference. Cancer cells, normal cells, totally different. They work differently. Another IV therapy that I love to do for prostate cancer is Artemisinin. It's an extract from wormwood, also known as artesunate in IV form. And this works very well synergistically with vitamin C. So it works by itself, but when we combine IV, high dose vitamin C and Artemisinin, they work so much better. But how Artemisinin works is it increases reactive oxygen species inside the cancer cell through the Ferris reaction, which is iron inside the cancer cell, makes reactive oxygen species, damages the cancer cell, undergoes apoptosis this way. Also, Artemisinin is one of my favorite substances to kill off infections, and many times people with cancer have chronic infections, so it has that side benefit of going and mopping up any of those infections that are going on in the body. Another IV therapy that I like to use for prostate cancer is quercetin. It is a natural substance. It's what makes a lot of food yellow. And quercetin has a lot of great effects on treating prostate cancer because it's a great anti-inflammatory. It decreases histamine throughout the entire body, and it also helps decrease the growth mechanisms of the prostate cancer. It helps decrease VEGF, tumor necrosis factor, etc. So it decreases that growth. And then it also has cytotoxic reactions on killing the cancer cell. So it's a really awesome therapy. I do a combination of oral quercetin, and then I do really high doses of IV quercetin to get that really strong hit of helping kill the cancer cells and decrease those growth mechanisms. Quercetin can work very well synergistically with a lot of chemotherapeutic agents and make those therapies work much better. IVC is the same way, helps those chemotherapies work more effective, increase effectiveness of the chemotherapy, decrease the side effect profiles. Timing definitely does matter, especially if you're doing conventional therapies, and it depends on what therapy you're doing. So for high dose vitamin C, I like to do before chemo, 1 day before chemotherapy, I'm doing IVC, and a day after chemotherapy, we want to do vitamin C. This will increase the effectiveness and decrease the side effect profile of most chemotherapies. Has been greatly researched on so many different chemotherapies out there. It's very important to put that close there. Quercetin is something I'll do close to chemotherapy if it is a therapy that's really good with it. So quercetin does interfere with some chemotherapy, so be aware of that, but I do that closely there. And then therapies that might interfere with chemotherapy or radiation or other conventional therapeutics, we're at least spreading it out by 72 hours apart from the therapy that is being administered. So just need to know exactly what timing. Obviously, you need to go to integrative oncologist to get this prescribed appropriately. The biggest misconception that I hear usually comes from their medical oncologist. So a lot of my patients come to me thinking they can't do a certain therapy because the medical oncologist said you can't do this or that. And then I have to share all the research to back that. But another misconception is that it's unsafe. It can be unsafe if it's done wrong. If you're going to a clinic that doesn't know what they're doing appropriately right, they don't know how to administer IVs appropriately. They're not sanitizing the area. They're not prepping the IVs in a clean room, so you don't get clean product. So that's really scary situations that can happen. So go to a medical center that is run by integrative oncologists that is following all the regulations that need to be followed by the pharmacy board and the FDA regulations. And so you actually get a safe treatment. So how do you really know if IV therapy is appropriate for you? So if you have prostate cancer and your kidneys are healthy and you've had a G6PD deficiency test, I would say the IV therapies that I discussed today are always going to be good for you in most circumstances, depending on what therapeutics you're receiving, depending on the vitality of the patient. But in most of the cases, IV therapies are going to be a therapy I almost always prescribe for my patients with prostate cancer because it really elevates the game. Besides diet and supplements, the IV therapies really give you a next level to have a good therapeutic response. If you're interested in setting up an appointment with me, or you want some more information regarding prostate cancer and how to treat it more in the integrative space, click the link below and you can set up an appointment with me.